Chris, Monica, and Sarah, would you mind turning on your videos at this time? Great. Welcome, everyone, to Taste of Success at Success Works within L&S. My name is Nancy Kuyak Ford, and I work at Success Works within the Strategic Initiatives, and I'm happy to be your host today. Today's session is concentrating on public health, and we have three fantastic alums that are here to meet and speak with you today. So before we begin, I want to make sure you listen to their stories and be prepared to ask questions, because every question is a good question. And in most times when you're thinking about a question, there is someone else on this call that probably has the same question. So please feel free to put in questions in the chat as we go along, or be ready after the introductions to give or ask questions. I'm going to start today with Chris Chapman. We would like to invite her to come and speak and tell us about her career journey. Chris?
Yeah, thank you very much, and thanks for having me here. Welcome to everyone who is hearing me. So like it was said, I'm a UW-Madison alumni. I don't know what the Latin word is for it, but I'll just kind of give you a synopsis of how I came to be where I am. I did my undergraduate work at the UW-Madison. I did a double major in international relations and Spanish, and when I was an undergrad, my original plan was to get a job in the Foreign Service and have like a kind of James Bond type lifestyle, and that was kind of my plan. So I did take the Foreign Service exam, did okay on it, but didn't pass. So I had to make a living for myself. So I spent a number of years working at a medical device company, working in exports, and so I used my language skills, and then I moved into a marketing position, so I was there for a while, but I really kind of was itching to continue my education, and I also was really interested in living abroad. So one day I had the bright idea of doing a master's program in Spain. So I found a master's program in Madrid, and I moved there, did the master's at the Universidad Carlos III, and I was actually able to continue working for my same employer at their office in Madrid while I did my coursework there. And then I did a master's in kind of like an international development type of coursework, and when the coursework finished, then I did a internship with an African-based NGO called AMREF, the African Medical and Research Foundation. And then my plan was to leave Spain and to go into the Peace Corps. And at that time, there was no Affordable Care Act, and I didn't have health insurance, so that was a major barrier. So then some other things happened, and I happened kind of into the marketing world again, and continued working for a number of years. But I still had that itch to do something a little more altruistic. So after a number of years, I quit my very stable job in biotechnology, and set about looking for a job, a full-time job, kind of more in the social services sector. And I was lucky enough through kind of attending community meetings and informational interviews to learn about a position at what was called then ARCW, the AIDS Resource Center of Wisconsin. They needed a bilingual case manager. So I was fortunate enough to get that job. I worked there for a few years, helping people living with HIV have access to medical care and other support services. Then I moved into a related job at the university with a group that trains healthcare professionals to care for people living with and at risk for HIV. And then I came into my current job, which is a patient and community engagement specialist with the UW Health HIV care and prevention program. And although it's very different from where I envisioned myself many years ago when I graduated from the UW-Madison, I've never looked back, and I'm very, very happy to be in the public health field. So that's my story.
Thank you so much, Chris. Well, now we'll move on to Sarah. Sarah, would you give us your history and career journey?
Sure. So my name is Sarah Clifford. I was an undergraduate at UW-Madison between 2013 and 2017. And so when I was an undergrad, I majored in biology and life sciences communication. I also had a certificate in global health. And so with that combination, I always knew that I enjoyed science, but I knew I didn't want to be doing bench work science. And so really for me, I took a lot of coursework, and when I discovered the certificate in global health, I realized that public health was kind of this combination of health science and communication and population health work that I was really interested in. So that kind of led me to realize public health was what I wanted to do. After going through a couple years thinking maybe it's med school, maybe, I want to go into infectious disease research or become a PA. So I went through a lot of those types of questions as an undergrad. And so luckily I realized it was public health that was really my interest area. And so I graduated from undergrad in 2017 and went right back to school in the fall. So I actually stayed at UW-Madison for about 2.5 more years. I got a dual master's degree in public health and a master's of science in life sciences communication. So I did those two programs concurrently, and since I graduated, I've been working at the Wisconsin Department of Health Services as a public health educator. And so this role really allows me to marry my two interests in infectious disease epidemiology and communication, and really informed communication to talk to various audiences. And so right now I'm working on COVID-19, and so I'm the communicable diseases health educator. So in normal times, I would be doing communication, education, and outreach work related to all infectious diseases, but of course COVID-19 has kind of been the core focus. And so it's a really interesting and exciting role where I get to work very closely with data scientists and epidemiologists, and that's where I kind of rely on my background in biology, but then work a lot with our communication team and think strategically about how we can communicate COVID-19 risk to Wisconsin. So that's how I got to where I am. Thanks.
And finally, I'd like to introduce Monica. Monica, would you please tell us your career journey?
Yes, hello. My name is Monica Palese. I graduated in 2012 with a Bachelor of Arts in Sociology, Communication Arts, and Global Cultures. I, to be honest, had no idea what I was going to do after university until probably my last semester. I think when I was entering my senior year, fourth year, one of my sister's friends who was in medical school at the time had pointed out, this public health field sounds like it might be something you might be interested in. She knew I was very interested in communications and sociology and kind of how people interact. I'd always been very fascinated about different cultures. I grew up in a household where we where we hosted foreign exchange students growing up, and so I had a lot of exposure. I had grandparents who were doing various work in Africa for 30 years in Liberia with leprosy patients, and I just loved it. I thought it was so fascinating, but I didn't know how to turn that into a job. And so I took the Intro to Global Health course my last semester of undergrad and realized it was spot on. That's exactly what I wanted to do, but I had already had an interest, a lifelong goal of working abroad. I'd had several family members who did the Peace Corps, but didn't really think it was exactly what I was looking for. And so I chose to join ISIC. It's a student organization at UW. And I had an internship in Colombia teaching English, and then another internship right after that in Spain, also teaching English, and I would volunteer on the side. And then that gave me time to apply to graduate schools. So I ended up going to graduate school a year later and got my master's in public health administration and policy from the University of Minnesota. And I originally actually went for community health promotion. I had a very strong interest in epidemiology, but I didn't think I would get into any top programs if I applied directly for epidemiology because my science background wasn't super strong. So I went for community health promotion and then ended up switching to public health administration and policy, just because I thought it was more of a challenge. I thought it was something that I didn't have a skill set in, and the community health promotion was similar to what I did in undergraduate. So I learned the hard way. I reapplied and switched programs and learned more about policy and how to connect what was going on in the community with what's going on at the higher levels of government, and how to kind of bridge those gaps between research in the community and the government and all of the different stakeholders that are necessary to progress the public health agenda. And so I apologize, my dog might be making an appearance. He is named Louis Posture, by the way. He's a big fan of public health as well, and very interested in this career topic. But so after graduate school, I moved to Chicago. I got a job with the Center for Clinical Cancer Genetics and Center for Global Health at the University of Chicago, and worked for a very fabulous breast cancer oncologist who studies and compares the genetics and causes of cancer between Africans and African Americans on the south side of Chicago. I learned a lot from her. I learned a lot from our research partnerships with our African colleagues. And then I did that for a few years and needed a kind of break from academia and from the research world. So I went to the Wisconsin Department of Health Services as well and worked for the Office of Health Informatics on their opioid epidemic surveillance system. So I helped work with medical examiners and coroners across the state and with the toxicology lab at the state of Wisconsin, and helped set up various informatics systems to help assess and surveil what the week-to-week case counts were like and overdose counts were like in the state of Wisconsin. So I did that for about 10 months before UChicago lured me back, and now I work for their Pediatric Cancer Data Commons program. I manage a very rapidly growing research portfolio. I think we're up to about $10 million right now, starting from about $1 million 2 years ago. So we're rapidly increasing, rapidly scaling up, and my job therefore has changed. But I now get to work with a really great team of technology experts, legal experts, pediatric oncologists from around the world to try to figure out how we can pool data. Given that pediatric cancer is a really rare disease, they need more cases to actually make meaningful discovery. Pediatric cancer is really lagging behind other cancers in terms of discoveries and treatments and long-term outcomes for those patients. And so I get to use my skill set from working with all of the international groups and multicultural people before to figure out how do we collaborate to solve this global problem together, because one country can't do it on its own. And that's where I'm at now.
Thank you so much for all your stories. I am definitely inspired as a bachelor's of science, but in English. And so I feel very underwhelmed. I feel like I should be doing more to help out the world like all three of you are. I want to encourage students to start thinking about questions you may have. This is your time with these three alums. So make sure that you think about some questions. We have one in the chat, and we will get to that one. That is, what would you say about some pros and cons about enrolling in a master's program abroad, which I think is a brilliant question. I would like to expand that a little bit to also say, generally, what are some different educational paths in this career, post-bachelor education in this field? I know each one of you took a different path to get your master's in a different field, but can you talk more generally about the post-bachelor's education in this field? And Chris, if you would like to turn your video back on, you can do that. And then if you wanted to answer the question about the pros and cons about enrolling in a master's abroad.
Yeah, so this is Chris. So just kind of like the pros and cons of enrolling. I mean, I'll start with the positive. I mean, it's definitely a great chance to be exposed to a different educational system and some different perspectives, both on teaching and in terms of like your classmates and that kind of thing. But on the con side, I mean, if you're looking if you're looking to work at an institution that's pretty competitive, like if there's a lot of applicants for it, a foreign master's may not be recognized if that's something, that an employer would look at. And there was like a significant amount of work to get a student visa abroad. I had to get fingerprints. It was a pretty involved process. So, I would say overall it turned out well for me, but those are some things people might want to consider before doing that.
We have another question in the chat.